everyone. I'm Erin Shoemaker, National Institutes of Health reporter at Politico. I am joined today by New Hampshire Senator Maggie Hassan, who sits on the Senate Health, Education, Labor, and Pensions Committee and serves as a ranking member of the Joint Economic Committee. We are here to talk about the threat of Medicaid cuts, the sweeping overhauls we saw yesterday at federal health agencies, and what these changes mean for your constituents in New Hampshire. Welcome, Senator. Thanks so much for being here today.
Thanks for having me. I really appreciate it.
Of course. Senator, I want to start with these mass layoffs and sweeping overhauls at the health agencies, which really shook Washington yesterday. What can you tell me about Democrats? Are there any tools in Congress that they can use to fight these cuts?
Well, let's just start with how devastating and chaotic these reductions are. Literally, employees arriving at regional offices yesterday and their badges just didn't work. No notice first. This is not only chaotic for the employees, it's a huge disruption to our healthcare system and to our public health system and to our systems that take care of children. Some of the people who couldn't access their buildings are folks from the Administration of Children and Families. They're the ones who support Head Start, for instance. So this is another demonstration of just how chaotic and disruptive and harmful the administration's actions are. We are certainly working to try to first get information about why and how these cuts are being implemented. We are trying to get information from the administration about what the plan forward is. But look, when I traveled to New Hampshire, just last week I met with a group of public health folks about the fact that the administration clawed back $80 million from New Hampshire that had been designated for public health services through the end of 2026. That means we are laying off public health nurses. That means we are having to close a mental health and addiction crisis line. I can go on and on with the kind of real impacts it has. At the end of the day, this also is really kind of a preview of what the Medicaid cuts that the Republicans are planning to make will do. It's going to decimate healthcare, ripping healthcare away from people just so that billionaires can get additional tax cuts.
So I do want to talk more about those potential Medicaid cuts. But in terms of tools, is there anything that Democrats can do besides collecting information, or once you have that information, you know, what can you?
Well, we have an oversight function that, as you know, this administration has been ignoring, to put it politely. So we will try to exercise oversight. There are certainly, I am sure, legal actions that can be taken as well. But the stonewalling that we're seeing from this administration, again, with the desire to really dismantle our healthcare system, is really, really concerning. And as you know, Chair Cassidy and Ranking Member Sanders have asked Secretary Kennedy to come into our committee next week. That would be a first step in us deciding what tools we have, what actions we can take. I hope Secretary Kennedy will take us up on the invitation, because it's really, really a critical time. So many Americans, you know, we're talking about tens of millions of Americans losing their health care because of the Republican budget proposals, but also because of the actions that this administration is taking.
We'll be looking to hear more on that for sure. Are there any places where Republicans and Democrats can work together on this? What do you think?
Well, I think the fact that you're seeing the chair and ranking member invite Secretary Kennedy in is a reflection of the growing bipartisan concern on the Health Committee, on the Finance Committee. You mentioned too, Joint Economic Committee, where we're looking at the data about the impact of these cuts on the economy and on people. But look, we have some bipartisan bills, as you know, on everything from rural maternal and obstetric care to site-neutral payments. But those are only really, they're relevant and impactful only if we have a healthcare system that is essentially close to what we have now. And if we are talking about the kind of Medicaid cuts that we're seeing the Republicans propose, we're talking about undermining, for instance, maternal care in a way that makes a rural maternal health care bill less impactful, less relevant.
I I want to turn for a second to New Hampshire and use that as a frame to look at these cuts. What are you hearing from constituents about the Trump administration, about the DOGE cuts, especially the health cuts? What are your constituents saying?
My constituents are really, really worried. So I'll just start with talking about the woman I brought to the President's Joint Address in March. She is a woman working in the private sector now who is in recovery from opioid addiction. Because Medicaid expansion exists in our state, it was a bipartisan effort to get that established in New Hampshire while I was governor. She was able to get treatment for her addiction. She is in recovery. She is working in the private sector now. She's on private health insurance. So all the things you want, we all want people to work. And she's acting as a peer recovery coach and really helping other people get into recovery. That is all at risk right now because, of course, New Hampshire is one of the trigger states. If federal funding for Medicaid expansion goes below 90%, we automatically eliminate Medicaid expansion, which, by the way, probably eliminates addiction treatment coverage for about 10,000 people in my state, eliminates care for about 30,000 kids, about 60,000 people overall if the Republicans go forward with it. Parents of a young man with autism who told me that their son gets his health care through Medicaid, they're very worried about their cuts. Going up to NIH, going up to Dartmouth Health, which receives NIH grants. It's one of the 57 cancer centers in the country, one of the few that's in a rural area. They have already seen layoffs and cuts that are impacting their capacity to do critical research that we are already invested in, right? So the administration is just wasting a critical amount of investment in critical life-saving medical research. And then we talked to a researcher up there, and some of this money goes to the medical school, Dartmouth Medical School. Some of it goes directly to the Cancer Center and to Dartmouth Health. But one of the researchers reported that she came down to Washington to present at a conference that was being sponsored by a sub-agency at HHS, only to be told she had to pre-submit her slides. She does research on mental health and addiction co-occurring among adolescents and teens, and they censored her slides. And I just want to say that again. This is the United States of America, and a scientist had her slides censored. She was not allowed to disaggregate her data by boys and girls. And they told her she couldn't use the term social determinants of health. So I am hearing from people who are worried about their actual care. I am hearing from people who are worried about the tax subsidies for the ACA being taken away, because that will be a huge cost increase for some of my constituents. And then I'm hearing from researchers who are investing in everything from mental health research to primary care research about cuts that are really tearing away critical care and life-saving treatment for my constituents. So the concerns are palpable, not just in healthcare, but everywhere.
So we have these palpable concerns. I mean, I've also been hearing from researchers about their funding being cut. We know that studies have been halted, trials, including on cancer. Things you've mentioned certainly dovetail with what I've been hearing. Even though, like in many cases, the money for that research has been appropriated by Congress, is there anything stopping President Trump from doing what he wants with that appropriated spending?
Well, many of us take the position that he is violating the Impoundment Control Act. Many members of his administration during confirmation hearings, when I've asked them about the Impoundment Control Act, just basically say that they don't believe it's good law, and I've reminded them that the Supreme Court has held that it was constitutional, and that if they want to change the law, they need to come to Congress to do it. And there are obviously lawsuits that are proceeding that have in which the administration's been instructed to spend the money. But at the end of the day, these things take time. But we are pushing as hard as we can, as are the lawyers who are representing the interests of the recipients of these funds. This is a constitutional democracy that has relied historically on good faith, on people all believing that the democracy comes first and that we're all operating with the same set of rules. It is deeply concerning, of course, that this administration seems to think that they are operating in a different context. And it's something that we're continuing to speak up about. We're obviously the minority in both chambers. We need a handful of Republican senators and a handful of Republican House members to join with us in their commitment to the democracy and to their constituents. And that's where constituent voices and people speaking up make such a difference.
I do want to talk a second about strategy. I mean, New Hampshire's an interesting state. It's got this well-known sort of libertarian bent and a purple constituency. Yeah. Do you have a different strategy than any of your Democratic colleagues? Like, do you have to pick your battles in some way?
Look, so for any of you who haven't been to New Hampshire, please come. It is the live free or die state for a reason. We were the first state to declare independence, and we were the 9th state to ratify the Constitution, which means we are responsible for creating the United States of America. Not that I would want to overstate anything. But look, we are a very special place. We also have a state house that includes a House of Representatives of 400 members, and we're 1.4 million people. And everybody works on a volunteer basis, and a state senate of 24 people. And then there's something called the Executive Council, which oversees the governor and approves every contract that the state enters into, for instance, of $10,000 or more. So we are a citizen-engaged democracy, and all I can tell you is that my constituents talk to me on a regular basis from all walks of life, from all political perspectives, which I believe is as it should be. And what they really want is, one, people who respect the Constitution and believe in democracy, and two, people who are problem solvers. And we are known for our libertarian streak, but also our bipartisanship. And the thing that I am focused on right now, I try to follow the example of my constituents every day in finding solutions, reaching across the aisle to do it. But to have true bipartisanship, you have to have a functioning democracy, because compromise happens when everybody at the table recognizes that each person negotiating has an equal say. And that is what is at risk right now. So I continue my commitment to bipartisanship, but I also know that in order for that to function, we have to have a democracy where the Senate and the House and every member is considered equally important because of who they represent.
I do want to circle back to that strategy question, but let's turn to Medicaid for a second. You're on the Finance Committee that oversees Medicaid and Medicare. House Republicans have proposed a budget that could significantly cut Medicaid funding. If that happened, what would the impact be on New Hampshire? So
what the Republicans have proposed in the House is a cut in the $800 billion range, about a third of Medicaid. And Medicaid, I mean, this is math, right? So the math is that if you're going to achieve those cuts, you either got to take away care from a third of the people or reduce what you're paying by a third. In my state, what this really means is that we are looking at, of the 180,000 people covered by Medicaid, 60,000 people would lose their coverage, 30,000 would be children, and obviously Medicaid covers, in my state, thousands of seniors, I think it's 15,000 kids with disabilities, and a lot of people who are working and who don't earn enough to afford private health care, or who are sick and want to return to work and need the health care in order to get back to work. About 10,000 people are covered for addiction care in New Hampshire by Medicaid expansion. So this would decimate, it would take away coverage for 1 in 5 people in our nursing homes. Nursing homes would close. It would decimate our rural hospitals. And as you know, about half of births in rural America are covered by Medicaid. So it may be half of births in all of America, but it's a significant portion, right? So the impact is unbelievably big, and people are really, really worried about it. And, I feel like we are relitigating the argument we had when we passed the ACA and relitigating the argument that we had when we established Medicaid expansion in so many states. People don't stop getting sick because we don't pay for health care. And that's the ultimate fact here, that we finally came together and recognized. And as you make these kinds of cuts to Medicaid, as if we don't reauthorize and reappropriate for the ACA tax subsidies, what happens is more and more healthy people leave the market, and that drives everybody's prices up. So for an administration that says it wanted to lower people's costs, they are acting in a way that will do exactly the opposite. People will be sicker, healthcare will be more expensive if you can get it, and the workforce will be increasingly strained. And private insurance will be.
Is there anything Democrats can do to convince Republicans to extend those Obamacare?
Well, we are working, we are making the arguments you are hearing right now, because just to give you an example, a couple, let's say they're 60 years old, so they're not eligible for Medicare, not yet. They're earning $80,000 a year, so a little bit over, more than poverty, but not a lot of money given today's expenses, right? It would push, by our estimates, their health insurance costs up $800 a month if the subsidies go away. So we are making this case to our Republican colleagues. Again, they need to be willing to stand up to this administration. That's how a democracy is supposed to work.
Senator, you stood out to me during HHS Secretary Robert F. Kennedy's confirmation hearing as being a forceful questioner and making a really vigorous case for vaccines. But you were also one of the 3 Democrats who voted to approve Marty Makary as FDA commissioner. We learned this week that Makary signed off on pushing out a top vaccine advisor, Peter Marks, and also those widespread layoffs at the health departments, including at FDA. Yeah. I'm curious, can you tell me a little bit about the calculation you made there in voting for Makary?
Yeah. So Dr. Makary has a very strong record of fighting the opioid epidemic and being realistic about the FDA's role in fueling the opioid epidemic. That is an epidemic that has devastated my state, and somebody at the FDA needs to hold the FDA's feet to the fire on the opioid epidemic, among other things. But let me talk a little bit about what is happening at HHS with regard to vaccines. Over the course of human history, we have seen charlatans, people we used to refer to as snake oil salesmen, exploit people's fears and their hopes and their desperation when it comes to illness of themselves or a loved one. And the way we have combated those charlatans has been with science. Science is the solution here. We now have a Secretary of Health and Human Services who is anti-science and dragging us backwards. Not only have they forced Peter Marks out, the guy who was, according to news reports, the person behind Operation Warp Speed, which has saved millions of Americans' lives, and brought in anti-vaccine pseudoscientist is the best way I can describe him, because he's been disciplined for practicing medicine without a license and administering drugs to children with autism that have harmed those children. And those drugs they were like prostate cancer drugs. And that's who he has brought in. So we are being pulled not only away from science, but into an anti-science mode by Secretary Kennedy. It is really disturbing, and it is something I hope to be able to ask him about should he appear before our committee, which he is supposed to do.
So on Makary's opioids, as a priority, the Trump administration has revoked, billions of dollars in funding for grants linked to addiction and mental health. They're folding SAMHSA, the Mental Health and Substance Abuse Agency, into another agency.
Right.
Do you feel misled at all on that front? Was there something that he said that convinced you to vote for him?
I think Dr. Makary, in good faith, said he is a scientist who follows science, which right now is really critically important, as I just laid out. And as I said, look, I voted against Joe Biden's nominee for FDA because he had been part of a group at the FDA who to put it mildly, was misled by the industry and allowed the industry to fuel the opioid crisis, and did not insist that the industry follow all the regulations and approvals it needed to do for the prescription of opioids for chronic pain and outpatient care. So I take Dr. Makary at his word about that. I obviously have a lot of concerns about what's happened in the last week, and will continue to push the FDA, for instance, to rehire some of the people. I mean, some of the layoffs make no sense in terms of, again, the investments we've already made in critical drug development.
I have one last question for you. Based on a little back-of-the-envelope math, among Senate Democrats, you're tied with Senator Shaheen in voting most frequently to confirm Trump cabinet nominees. You're also among a handful of Democrats that voted for the continuing resolution. There's a debate among Democrats about how to handle the Trump administration, and you're taking a position here. Why is that?
I voted to keep the government open because empowering President Trump to have unilateral power was not something I thought was right. And I think a lot of people hadn't realized that with a government shutdown, President Trump and Elon Musk would have even more power. And the thing about government shutdowns historically in this town is that both parties have an incentive to reopen the government. I do not believe Donald Trump and Elon Musk share that incentive. And so I thought it was far more dangerous to allow the government to be shut down under this administration. And I think because I see clearly how Donald Trump and Elon Musk think of themselves, which is as rulers, not as leaders or servants in a democracy. So I think it was critically important to keep the government open, as difficult and bad as the terms of the continuing resolution were. And I think we're seeing that play out right now, which is people in my state, as decimating as some of these cuts are, there still is some functioning government going on. Now, that is not, that should not be the bar and the goal. We need, again, Republicans to join us in standing up to this president. And it will just take a handful in each body. And they have to decide where their commitment lies, whether it is to their constituents and the democracy and progress, or whether it is to Donald Trump, who is on a regular basis violating the law and violating the Constitution.
So beyond the CR, why vote for some of these nominees? Why not stand up to the administration? The people in your state are being decimated by some of these decisions.
The people in my state are being decimated by the decisions of this administration. And what this administration has proved time and time again is that it is bound and determined with Musk and Trump to create chaos and confusion and cause great harm and be really cruel in the process. Now, there are some nominees who I think are qualified people who are trying to act in good faith. I think one of the things we have learned over the last couple of months is that some of the people who are qualified and seem to be acting in good faith are either just doing what the administration says or has no voice in the administration, and that is certainly influencing the way I look at future nominees.
Senator, thank you so much for your time. Up next, we have Politico's Lauren Gardner, who is sitting down with FDA Commissioner Scott Gottlieb. Please join me in welcoming them to the stage.